This is the female reproductive system, starting on page 222 with anatomy. Our first image, an egg cell or ovum is produced in the ovary and travels through the fallopian tube. If a sperm cell is present and fertilization, which is the union of the egg and sperm cell, takes place, the resulting cell or embryo may implant in the lining of the uterus. The embryo, later called the fetus, develops in the uterus for 9 months and is delivered from the body through the cervix and vagina. The next image on the bottom of page 222, the breast contains glandular tissue that produces milk after delivery of an infant. The areola is the dark pigmented area surrounding the mammary papilla or breast nipple. There are numerous lymph nodes around the breast and in the underarm, known as the axilla. Our terminology for the female reproductive system: we have cervico, which means cervix. So cervical is pertaining to the neck of the body or the neck or cervix of the uterus. Colpo is vagina, colposcopy, visual examination of the vagina and cervix. Vagino means vagina. Vaginitis is inflammation of the vagina. Hystero is uterus. Hysterectomy, excision of the uterus, either through the abdominal wall, which is an abdominal hysterectomy, or through the vagina, vaginal hysterectomy. Mammo means breast. Mammogram is an X-ray record of the breast. Masto also means breast. Mastectomy is removal or excision of the breast. Metrio is uterus. Endometrium is the inner lining of the uterus. Utero also means uterus, so uterine is pertaining to the uterus. Ova means egg. Oocyte is egg cell or ovum. Oophouro is ovary. Oophorectomy is removal of an ovary or ovaries. Ovario also means ovary. Ovarian cancer is malignant condition of the ovaries. And salpingo means fallopian tube. Salpingectomy is removal of a fallopian or uterine tube. Next is the pathology section for the female reproductive system. Amenorrhea is absence of menstrual flow. Dysmenorrhea is painful menstrual flow. An ectopic pregnancy, a pregnancy or gestation that is not in the uterus, and it usually occurs in a fallopian tube. Endometriosis is tissue from the inner lining of the uterus, the endometrium, and it's found abnormally in other pelvic or abdominal locations, such as the fallopian tubes, ovaries, or peritoneum. Fibroids are benign tumors in the uterus, also called leiomyomas. Lyo means smooth, referring to visceral muscle within an internal organ. Menorrhagia is excessive discharge of blood during menstruation. And pelvic inflammatory disease, inflammation often caused by bacterial infection in the region of the pelvis. Because the condition primarily affects the fallopian tubes, it is also called salpingitis. Next are laboratory tests and diagnostic procedures. Amniocentesis, puncture of the amnion, which is the sac surrounding the developing fetus. Aspiration is withdrawal of fluid from a cavity or sac. In breast aspiration, a needle is used to remove fluid from cystic lesions in the breast. The fluid is analyzed for the presence of malignant cells. Colposcopy is the visual examination of the vagina and cervix with a colposcope, a small magnifying instrument resembling a mounted pair of binoculars. Conization is removal of a wedge-shaped section or cone of the cervix for biopsy. Hysterosalpingography is X-ray imaging of the uterus and fallopian tubes after injection of a contrast agent into the uterus. Mammography, X-ray imaging or recording of the breast. Pap smear, insertion of an instrument, spatula, into the vagina to obtain a sample of cells from the cervix, the neck of the uterus. Microscopic analysis of the smear can detect the presence of cervical cancer. Pelvic ultrasonography, recording or imaging of sound waves as they impact organs in the region of the hip. In transvaginal ultrasound, a sound probe is placed in the vagina. Pregnancy test, measurement of human chorionic gonadotropic or HCG, a hormone in blood and urine that indicates pregnancy. Next, our treatment procedures. Cauterization. Heat is used to destroy abnormal tissue, for example, in the lining of the cervix, the lower neck-like region of the uterus. Cryosurgery. Use of cold temperatures, often liquid nitrogen, to freeze and destroy tissue, such as the lining of the cervix. Dilation in curettage or DNC. Widening, dilation, or dilatation of the opening of the cervix and scraping of the lining of the uterus to remove tissue and stop prolonged or heavy uterine bleeding. Hysterectomy, excision of the uterus either through the abdominal wall, abdominal hysterectomy, or through the vagina, vaginal hysterectomy. Myomectomy, the surgical removal of fibroid or myoma tissue from the uterus. Uterine artery embolization may be used instead to shrink the fibroids. Tiny pellets are injected into the uterine artery. The pellets act as emboli to block blood flow to fibrous tissue. And then we have tubal ligation. Fallopian tubes are tied off or ligated and cut to prevent pregnancy. And then our abbreviations for the female reproductive system, we have CS, which is cesarean section. Fetus is removed through an abdominal incision. DNC, dilation in curettage. DUB, dysfunctional uterine bleeding, not associated with menstruation. GYN is gynecology. HRT is hormone replacement therapy, estrogen and progesterone. IVF, in vitro fertilization. Egg and sperm are combined outside the body in a laboratory container. Fertilized eggs are injected into the uterus for pregnancy. OB is obstetrics, which is labor and delivery of a fetus. PID is pelvic inflammatory disease, salpingitis, oophorytis, endometrititis. Leading causes are sexually transmitted infections. STI, sexually transmitted infection, also called STD or sexually transmitted disease. And then we have TABSO, total abdominal hysterectomy with bilateral salpingo-oophorectomy. The entire uterus and both fallopian tubes and ovaries are removed.